Okay, hello and welcome everybody. Thank you for joining us today. I know we have a lot to cover, and I am not the clinical person on this call, so I'm going to start right away and turn it over to our speakers. Our topic today is age-friendly health systems, the age-friendly pharmacist, and our agenda, as you can see today, we're going to be covering a lot. So we're going to start with Dr. Joshua Raymond, who not only is many things, a professor at RWJ Medical School, in charge of the residency program, but also a New Jersey Advocates for Aging Well board member. And we appreciate him helping us make these connections today. I will silence myself and turn it over to you, Josh.
Thanks. Thank you, Kathy, and welcome everyone. And thank you for taking your time to learn about the age-friendly movement, in particular, the age-friendly pharmacist. I'd like to give a little bit of background that goes along with the age-friendly movement. Starting back in 2017, the American Geriatric Society, in collaboration with the John A. Hartford Foundation, established an aging-friendly movement. They thought that it was important to teach the essentials of geriatric care, and they asked a panel of experts and consultants to come up with the 20 best uh, geriatric concepts, and they came back with just four. And they've rolled this out as the aging friendly movement starting in 2018, and there are now 6,000 organizations in the United States that are age friendly. Age friendly can apply to hospitals, to doctors' offices, to nursing homes, to communities, to universities. And here at Rutgers, we have an age friendly ecosystem. I live in an age friendly town. It has a remarkable senior center. So there's really the movement can go and be implemented in many different environments. What they decided about the four M's was it was what matters, uh, mobility, mentation, and the reason we're here today is for medication. Some people say there's a fifth, but officially there's really only four. But in parentheses, sometimes you'll see multi-morbidity. Starting in April of next year, the Centers for Medicare and Medicaid Services will require hospitals to attest that they're gathering data on the four M's, and they'll be reporting that ultimately to the CMS. That patients will be able to express their wishes about advanced directives or treatment options. They'll be making sure people aren't having falls and that they're able to be mobile. And they'll be screening for delirium, dementia, and depression. And when people do leave the hospital moving forward, they'll make certain that people know the medications that they're taking and how to take them. So there's a lot of excitement, and the importance of medication can't be overlooked. Medicines are here to help people, and when they're used judiciously and controlled, they do very well. So I'd like to hand it over to you, Kathy, again to teach us about the age-friendly pharmacy movement. And there's a dotted line that goes to the medication with that.
Okay, thank you. So with us today, we have Deborah Schimpf, who's going to talk about the age-friendly pharmacist champion program and her background and experience. Deborah, if you take yourself off mute and just let me know when you want me to move on to the next slide.
Yes, thank you very much, Kathy. Thank you everyone for joining us today in the last few days of summer here to learn about age-friendly and the four M's, and impact on our long-term care and assisted living in our nursing homes. So just a little bit of background about myself. I am the Director of Clinical Services at Guardian Pharmacy of New Jersey, and I service nursing homes, long-term care, subacute, assisted living, group homes, so quite diversified here. And I've been an age-friendly pharmacist champion of the Northeast, and I am implementing age-friendly movement in my nursing homes. I already have one that started that just applied like a couple days ago, and I'm very excited to teach on what age-friendly is to the pharmacists and perhaps the social workers that are on and the rest of the audience here. Next slide. So I have no relevant financial relationships or so no nothing. So you can go to the next slide. So our learning objectives today, I'm going to describe what an age-friendly care is and what the four M's are. Identify the domains of the age-friendly hospital measure that Joshua just talked about. And then also on how you can start in a nursing home in our long-term care and define the path to be recognized as an age-friendly pharmacist, an age-friendly healthcare system. Next slide, please.
Did that advance?
Yes. So
Okay.
it all started with the John Hartford Foundation. So it's a private philanthropy based in New York City. And they thought about the age-friendly movement way back in 2017. So next slide. So why age-friendly? Next slide, please. Okay. So why age friendly? So the United States population is aging. In 2020, 1 in 6 people in the US is an older adult. An older adult is defined as anyone over 65. And also, this population is becoming quite diverse. So over from 2010 to 2020, you can see that Black, African American, Asian, American Indian, Alaskan, Native Hawaiian, Pacific Islander, all other races besides white, they grew from 15% to 23%. And the Hispanic and Latino population also grew from 7 to 9. So our older population are becoming very diverse. As we age, we also become more complex. We have more, we have more complications as we age. We just don't have one, we don't just have hypertension. We have COPD, hypertension, diabetes, etc. So it becomes very complex. Our health systems are not prepared for this. So our geriatric population are at risk because they're frequently in and out of hospitals, transition of care, and as Joshua mentioned, that as we age, we also our medications increase, so there it gets more complicated, so they're more at risk. So to address all these challenges, in 2017, the John Hartford Foundation, the Institute of Healthcare Improvement, which you see at IHI, partnership with American Hospital Association and Catholic Health Association of the United States, had this bold vision to create this social movement talking about age friendly and labeling the four M's framework. Next slide. So what is the four M's framework? It's not a program. It's like a different mindset. So it is focused. It's a shift on how we provide care to our older adults. And it's like pieces of a pie, and all the four M's are a set of evidence-based, and they fit all together. And the most important part of this piece is the patient. It's all patient-centered, and talking about the patient and what matters to the patient. So nursing homes right now practice some of these four M's. They might not be documenting correctly in the right spots, and they're not working together with this. So that's what this movement is, to look at all the four pieces and work together. And they have to be practiced. So you're following an essential set of evidence-based practices, and it causes no harm. So why not? And it aligns on what matters to the older adult. Next slide, please. So our whole society needs to be age friendly. All of our populations are growing, and it's older. So it's not just in our nursing homes. We're talking about out in the community, education, workplaces. All of us need to be age friendly, and we need to look at what matters to the older adult and to be able to address all their concerns. So we all have to be age friendly. Next slide, please. So why? So number of older adults is projected to double over the next 25 years. So they're very complex. So approximately 80% of our adults have one chronic disease and 77% have at least two. So with the complexity, as you have more chronic diseases, your medication increases. So our average adult in our nursing homes, there are upwards of 20 different meds, and polypharmacy starts at just five, and we have 20. So it gets very complex and disproportionate harm. So the older adults are more at risk to go and to be in and out of hospitals, and then there's errors that happen in the with the transition of care with not following the adults. The older adult gets confused. They don't know what medications to take. They're at increased risk of falls, dementia, delirium, mobility. They keep so it disproportionate harm because they're and every single time you go to the hospital, and I have my mother as an example. Every time she went into admitted to the hospital, she got worse and worse. And talking to her physicians, every time you go to the hospital for an older adult, you never really get quite back to that baseline. It gets lower and lower, so it's more complicated, and they're at that risk. Next slide. So this just gives us a little bit of a timeline here. So again, it started back in 2017. So the IHI, the John Hartford Foundation and the partners, the Age-Friendly Healthcare System partners, piloted the 4Ms in the hospital. And then in 2018, they launched their first action community. In 2019, they established 20 action communities over. 2020, they started it in nursing homes, and I personally didn't even know they started in nursing homes. In New Jersey, there is not one yet, but hopefully the one that just applied a few days ago will get will be my first, and I'm hoping to get more. And on 2021, IHI launched a free open school course to teach students around the world. I actually took this course when I started it to be an age-friendly pharmacist way back in the beginning of the year here. And it is quite helpful. So that's education there. It's free. So I always like to be free. And then the CMS released a new age-friendly hospital measure. Was supposed to be effective to January 1st, but from Joshua, it sounds like it's not going to be taking effect until like next April. But they were
Mhm.
trying to aim for January 1st. So the hospitals in our area are already starting. So we have our Atlantic healthcare system. I know that they are age friendly. And Robert Wood Johnson, I believe they are age friendly as well. Hackensack Meridian is age friendly. So we have age friendly hospitals in the area. Well, why we should have age friendly nursing homes, long-term care and assisted living too, because we're the ones that are taking these patients. So we need to have age friendly in our nursing homes. Next slide, please. So this just gives you a little bit of a background in the CMS age friendly measure domains and how the crosswalk to the 4Ms. So I was actually speaking to one of my friends that her father was in Atlantic healthcare system just recently. And the social worker came to the room and asked the geriatric her dad all these questions on is there someone home to take care of you, your mentation, how mobile are you, how what matters to you. So the hospitals are already doing this as part of their discharge plan, and this just gives you that crosswalk. Next slide, please.
Did that advance?
Um,
No. There we go.
okay. So I already talked to you about the course. I highlighted that. I really highly recommend everyone going on there. It's free to learn about age friendly from and then also, so the hospitals are invites the hospitals to take action, but also the nursing homes too. Next slide, please. So our goal as long-term care pharmacists is to bring age-friendly care in the four M's into our nursing homes. And I don't want to really say long-term care only. I feel that the assisted living is also at risk. The assisted living are not as regulated as long-term care. So I honestly see a lot of polypharmacy in assisted living because they're not as regulated. And then you can see there's a lot of supplements, a lot of drug interactions, and they're also at risk. So I think it should be in all settings, subacute, long-term care, and AL, and then even, group homes and out into the society and the community. Next slide, please. So these are the four M's. So we've been talking about the four M's right from the beginning. So what are the four M's? What is the four M's framework? So the most important for the M is what matters to the patient. This is patient-centered care. And we need to ask what matters to them. We need to ask what what makes them happy? What is your primary goal? What and that's what we're looking at. Know and align the care for each, looking at the health outcome goals and the care preferences. And it causes no harm. We're looking at the other M's, mobility. So we're looking at like fall risk, and looking at so the most in a geriatric patient, the most they're fearful of falling. So they need to feel comfortable in their environment, that they're not going to fall. And then also our medications are important too, to not be on too many fall risk medications. So we need an overview on that. So the consultant pharmacist looks at that. Of course, our medication, that's our pharmacist M. So polypharmacy is in our nursing homes, and we're always looking to de-prescribe. Before starting a new medication, we have to look and seeing if it's is all the medications at their optimum dose. Is there any side effects caused by these medications that you're starting a new medication because of a side effect, it's called a cascade prescribing. So we're looking also at our high risk groups like our diabetic meds, our anticoagulants, our opioids, our antibiotics. We're looking at the Beers list. We're looking at the anticholinergic burden. Those are all the focus points that a consultant looks at in our homes. So that's the medication M. The last one is mentation, and mentation encompasses the three D's. So dementia, delirium, and depression. It's so important that we assess all of our residents for these three D's, especially the delirium. And I saw that with my mother. She was in the hospital, and within 48 to 72 hours, sometimes delirium can set in, and it did for her. She was starting to see things. Nurses were going through walls. She was not my mother. So it happens it happens quite often. It also happens in the nursing home if you move the patient's room. They get so confused, like in a week and a half, they need to, grow accustomed to their new room. So it's very important that we're not starting a new medication, like perhaps an antipsychotic, when you first move a patient, because maybe it's just delirium and maybe it's just, change in their environment. So that's our mentation M. Next slide, please. So I already reviewed the what matters. So we're going to look at what aligns with what matters to the older adult, their care preferences. So when you're asking the adult, what makes you happy? So that's so important in our long-term care settings, because they need to have a purpose. They need to have activities to make them happy. They need to get out of their rooms and socialize. Nobody likes to be alone. So that's important when you're assessing the resident. And you're looking at the resident, you're asking what matters. So the social worker comes in and they assess the resident. You have your activities department involved to get that resident out and involved in bingo or music, etc. Also asking the resident when they like to go to bed, when they like to wake up, because sometimes you may be waking up the patient at 7 o'clock in the morning to give them meds, and they don't like to be waken up at 7. They like to sleep till 9 or 10. So it's important to ask. And when do they like to eat? What do they like to eat? I've seen a patient being put on like an appetite stimulant because they were losing weight, but nobody took the time to ask the patient, well, what do you like to eat? Why, what possibly is the reason, losing weight? So maybe they want some macaroni and cheese or a peanut butter and jelly sandwich. This approach of the 4M's simplifies things. We're as clinicians, we think of things very complex, but it's not. We need to make it simple. We need to see what matters to that patient and simplify things. Medication, of course, I've talked about that. So all of us as consultants, we look at the fall risk. We're looking at your antipsychotics, your psychoactive meds. You're looking at the anticholinergic burden. You're looking at the Beers list. And deprescribe. The more meds you add, there's pill burden. The patient doesn't want to be taking 20 meds at the same time. And to be interrupted throughout the day. If you have like 6 med passes during the day, it interrupts their life. So you need to look at what your medication and what matters. Mentation to prevent, identify, and treat, manage delirium, depression, and dementia. And mobility, and asking the patients like what matters to you. Like for my mother, mobility is so important. She just wants to come home and visit me on the holidays. She wants to be able to move safely into the car so she can come home and visit. She's in a wheelchair right now, and that's what moves her. That's what's important to her. Next slide, please. So everything we talk about with the 4M's, you need to assess and then act on. So in our nursing homes, we have care plans, and all of our care plans need to focus the 4M's. So recently, one of my nursing homes just started, and they have Sigma Care, and they have a focus note. So they did it for antibiotics, did it for psychoactive, but now they have a focus note that says what matters. And in that, the social worker puts what matters to the patient. And then now all of us can go in to the progress notes, the focus notes, and see what matters to that patient. You can also put the mobility notes. So there's a centralized location. That's the most important, is to have a centralized location where the pharmacist, the psychiatrist, the physical therapist, the nurse, everybody can look and see what matters to that patient. Next slide, please. So steps to earning the digital badge. So thanks to ASCP, they have a great program that I did last year at our convention in fall, last November, I guess it was the beginning of November. So the steps to earning a digital badge, there's 4 steps. Now this is just not for pharmacists. And this is where I want to stress, I know it says pharmacists. I know when you go on to ASCP, it only talks about the pharmacist, but this is not just the pharmacist. And you don't need to be a member. And the whole program is free. And you can enroll as a non-member and go through you won't be able to get credentialed at the end as an age-friendly pharmacist, but you will have the background on all the 4M's. So with the IHI program, this program is essential to give the background to all. I am a preceptor for FDU, College of Pharmacy, and I also have Rutgers students with me. And I actually require them to go through this program. And it's exciting for them because they're not even pharmacists yet. And then once they become a pharmacist, they tell ASCAP, it's like, I have a pharmacy license, and now they're an age-friendly pharmacist. So that's I have all my students go through this program. I would want all the nurses to go through the program to get a background, and the social workers. to learn about all the four M's and how we can incorporate this in our nursing homes. Next slide, please. So this just goes through the four main programs here. So it is the four M's. So what it matters to me, of course, is what matters, not another pill. So that's the pharmacist one. That's the medication one. Too much on my mind is mentation, and gotta keep moving is the mobility. So you're going to be learning. They're going to give a lot of tools. So I went through all these programs and then they give you references and then I linked onto the references and read more and read more and then I came up with, and I'm going to be showing you in another slide coming up, I came up with a toolkit for all my nursing homes to make it easier for them and to give them some steps to make it like less complicated for them. So next slide, please, Kathy. So this is the age-friendly, the website to become age-friendly. So it's very simple. My students, I had no problem with anybody going on and doing this. It walks you right through it. And then once you enroll, you can go in and out. You don't have to do it all at once. You'll get a PowerPoint presentation that you can refer back to. You can also use for education. You can save and use it for education. And then there's little tests at the end. They give you 3 tries to pass. It's quite easy. It's very educational. I would advise to write down your answers so you get it right at the end, so in case you keep getting the same questions wrong. But it's very informative. And at the end, you'll be able to get, if you're a pharmacist, you'll be an age-friendly pharmacist credentialed. And then if you're not a pharmacist yet, like you're an APPE or an IPPE student, you can get credentialed when you become a pharmacist. If you're a social worker, this is education in your CAP, and you can use it and you can teach your other the other disciplines like the occupational therapist, the physical therapist, and the team. Even the activities director should be taking this. Next slide, please. So my toolkit. So I started with the guide of care of older adults in nursing homes. So I would recommend just briefly going through that, but the workbook really helps. It breaks it down and makes it a little bit more simple for the homes. And the worksheet is very informative. So the worksheet gives you like screen assess. It gives you the tools that you're doing right now. So it gives you like all the tools for assessment, the frequency that right now what you're doing in the home, like at admission, upon change of condition, or quarterly, monthly, where you're documenting that particular M. And then the most important is who's responsible for that M. So that's why I like this description worksheet because it gives you it makes it simple. It does look a little bit complicated when you look at the guide, but when you look at this worksheet, it breaks down all the steps and now it's not so complicated. And then you can have your champions in your nursing homes. So who's the primary responsibility for mobility, for example? So that would be your physical therapist, but that would also be your nurse too. So that's combined there. Um, and then for your medication, of course, it's your pharmacist, the nurses involved. Like involved in that team. So you're identifying and who's the champion of that team. Next slide, please. So what matters to older adults? This is a great toolkit to use. It gives you a lot of references for the questions you should be asking your older adults and preferences in like for their day, like when they want to wake up, what they eat, what makes them happy. Those are the questions and references are in there. Age-friendly mobility assessment tools. Also gives you the tools there for your physical therapist, what you're doing in your nursing home or your setting. Next, please.
Did I skip one?
Nope. One more slide. So I love that. I found this when you're starting to look at all these references, you start going on links, And I found this one, A Guide to Addressing Resident Goals, Preferences, and Priorities, GPP from Moving Forward. It is awesome. It has the best tool for CNAs. So let's think, who knows the resident most in a nursing home? Who is with them all day long? Is it the nurse? Is it the CNA? Is it even just the housekeeper? So I find in my nursing homes that the CNAs and housekeepers know the residents sometimes even more than the nurse. So in this guide, it gives you a toolkit it gives you questionnaire for your CNAs to track your residents. It gives some guidance for the CNAs that they can complete and hand off to the nurses after like a 2 week period of time after they're getting to know the resident. I found it very helpful. And I know that CNAs don't go into your EMARs, but they can take this guide, they can fill out the questions, and they can give the answers to the nurse, and that can be put in part of the care plan. I feel the best part about the 4Ms is the collaboration of the whole entire team in the nursing home. Everybody plays a role and everybody is important. Those CNAs, the housekeeper, the physical therapist, the occupational therapist, everybody plays an important role to take care of that resident. And and the CNAs are like, you take pride in their job more for what they do. It's like, wow, they're in part of the care plan for that resident. There's a detailed preference interview there. I included, so that was part of that link to the guide. That's there too, and the links are below. And I found something else. It's the Alzheimer's Society. This is me. This is very simple that the resident can fill out. So one of my nursing homes did something so moving for me. I actually had a tear in my eye when I saw it. They have shadow boxes outside all of the residence rooms. And this is a convent, in matter of fact, so it's all sisters' rooms. So it's a long-term care building, but it's all sisters. And in the shadow box, it tells you about the sister's life. It tells you where they were born, what they liked, what they did for a living, what moves them, what makes them happy. It gives a glimpse of what matters to that sister. So and I saw it, and it took my breath away. And now I'm talking to all of my nursing homes and say, you know what? To all of us need to know that resident. We need to look at our resident as not just a patient, but as a human, just like us. And and they want to talk. They're social. So if you look at what this is me and what moves them, so if art is what moves them, so maybe you want to talk about what they did in their life and artwork or football or soccer. And now you have something to talk about when you're changing them or when you're passing meds. And now everybody in the home gets to know about that resident. So that's why I think that the This Is Me, the shadow boxes, are creating something like a poster about what the life of that resident to bring us closer to that patient. Next slide, please. And I think this is next slide. So this is my conclusion. So I wanted to give you my email. So I have the workbook at the toolkit of all of what I've talked about. I would be happy just to give you the attachments instead of you going on and trying to come up with all the attachments by going through my links. I made this toolkit. I printed it out for all my nursing homes. I put it in a binder. It's so much easier to reference. I'll be happy to help any of the nursing homes in assisted living and any of the other pharmacists, the consultant pharmacists, with this toolkit. So just please reach out to me and I'll be happy to provide this information to you. Thank you, everyone, for your time.
Thank you. That was a lot to cover, but I really appreciate you going into detail, and it does sound that the way you describe the 4Ms and the intersection of the interaction, is important in nursing homes and in any part of the healthcare system. So now we're going to turn it over to Avra Thomas. I don't know if Chad Wars is able to join in, or Avra, are you going to talk for him?
I will never talk for Chad, but if he's available, he can chime in at any time. I can get us started. But thank you for having us here today, and thank you, Deborah, for giving an overview. Deborah is one of our champions, our regional champions, representing ASCP in this age-friendly movement, as we leverage pharmacists as age-friendly champions. And this is to help older adults and those that care for them navigate the complexities of managing medication. It's incorporating long-term care pharmacies and pharmacists that have expertise for the specialized care of older adults, along with this age-friendly health systems movement. In partnership with the Peter Lamy Center on Aging through the University of Maryland, we've developed the education that Deborah spoke on and the age-friendly badge for more so, it's accredited for pharmacist education, but we've also seen others take advantage of that education and maybe go through their accrediting bodies to see if those credits can roll over as well. Great education. What we did with the education is ensure that it's collaboration with the interdisciplinary team. So through the modules, there is representation from a pharmacist with a physical therapist, a pharmacist with a physician, pharmacist with social work. So we wanted to make sure that that was inclusive in our education and training, and how that the education to roll out and really be supported by an IDT approach. As we move into year 2 of our programming, we're focused on implementation. As Deborah mentioned, as she's working with our nursing facilities to also roll out the education that's available through the John A. Hartford Foundation and some of the toolkits that are available. We really want to spread the word within the community to touch other older adults, not just in nursing facilities, but through the community and through pharmacy partnerships and partnering. Um, if Chad's on, he can also share some other things and some other updates that we have. But it's really our goal, our overall overarching goal is to enlist pharmacists and pharmacies to help bring this age-friendly care and movement in LTC, long-term care settings, and improve the care for older adults and their caregivers as well. In the chat, I prior to starting, shared a link. If you guys could take advantage of that survey, we really want to get an understanding of who's represented on this call. I believe it's going to be a diverse group, but we've shared with our membership as well, so we may have some pharmacists on. If they're not already members, we welcome you to learn more about ASCP and take a look at our page, ascp.com, age-friendly. I believe it's /age-friendly. I will drop the email address to link to our page where our education is housed for more information. And welcome to, if you have any questions, feel free to come off mute or put it in the chat. And I will pause for a second to see if Chad is in a position that maybe he can share a little bit also more that we have and just kind of give you some background.
I see he had put in the chat that he's not in a place to jump in,
Okay.
but that
No, no
Afra will
problem.
do wonderful.
Okay. No, also just want to say that we are
There he is.
ASCP is represented in eight regions across the states, and we hope to train over 2,500 pharmacists in 150 long-term care facilities. And also looking to at least 200 long-term care settings and for earning that age-friendly recognition. So we have a lot of work to do. We have a number that have already obtained the age-friendly badge, and so we're happy to see that the word is getting out, and we encourage you to spread the word too. So whether you're in a facility or in the community, working with your community pharmacists, share the information as well as we build on this movement.
Thank you. Would you like to open it up to questions, Donna? Or
Yes, yes.
yeah.
Hi. Hi. I just want to welcome everyone, pharmacy and non-pharmacy members. This has been a dream come true to have two of my favorite organizations unite in this effort. New Jersey Advocates for Aging Well has been a champion of aging policy in the state for decades. I was involved in going to their conferences back in the 90s, and they've always been at the forefront. What they come up with in terms of recommendations are often listened to by Trenton and followed through. And so it's really great to have them in our corner. As for ASCAP, ASCAP is the premier organization for senior care pharmacists. And it's so great that this was a chance to partner with both organizations to spread the word about age-friendly care. This is a movement that's going across the country. ASCAP is doing a large part here, and commend them for getting the word out about the role that medications have in the care and the lives of older adults. It can enhance it and it can hurt it as well. So having a pharmacist there as part of the team, along with the physician and the nurses and physical therapists and all the others that are involved with medication therapy to safeguard the older adult is a privilege to be able to do that. And so I'm delighted that that this opportunity was brought upon us today, and hopefully the partnership will be a lasting one. I say that as I'm the state delegate for the American Society of Consultant Pharmacists. And for those pharmacists who are on this call, I urge you to reach out. I will put my email in the chat. If there is anything that you would like to bring to ASCAP, I can be your voice for that. And I'd love to be your voice for that. So please feel free to reach out to me. I also want to say this is so timely because right now, for example, with the mobility issue, we are in fall prevention month, and the week of the 22nd will be fall prevention awareness week. And so there was just an article that appeared on September 7th in the New York Times that talked about the number of older adults that are falling, and they asked the question why, and they came up with the temporary answer, because the teaser in the subtext was that it's due to medications. And then they do go through and they explain there are other things for frailty, aging population, but medication still stayed at a focal point of that article, whether it was opioids, whether it was things like benzodiazepines or gabapentin. So the public is aware of this. And I think, right now, this is a great opportunity for pharmacists as part of the healthcare team to showcase the skills that they've trained for their whole life. There are other age-friendly movements too. ARP has age-friendly state and communities, which are another great way to get involved in the community, as well as TIFA, Trust for America's Health. They also have age-friendly public health systems. So, ASCAP's at the forefront here now, advocating for pharmacists. But this is going to be, they talk about the aging tsunami, and that is kind of a negative connotation, but just to show you the scope of what's happening in terms of aging services. And it's great to see that, ASCAP has partnered with New Jersey Advocates for Aging Well to bring this word to New Jersey to help improve the life of all older New Jerseyans. I live in Somerset County. We have 4 adult communities, and New Jersey is a hub for a lot of older adults, whether they aged here for all their lives or if they're coming here to live here. We have closeness to the city, great opportunities for education and healthcare. So there's a lot of fantastic things about New Jersey, and helping to assure that they're living their optimal life, knowing what matters most to them, making sure that the medications are helping achieve what matters most and not taking away from their lives. That's so important. I do want to ask everyone who has questions whether they want to unmute and speak, or if they'd like to actually like to place them in the chat, and I will assist you with that. There was a comment earlier that I do want to say that Dr. Raymond had mentioned a clarification. The hospitals need to attest that they are collecting age-friendly data by April of 2026. So, but that was the April 2026 date, was to attest that they're collecting information. So with that, does anyone have any questions? Please feel free to come off and mute. And I will also put my email address in the chat for anyone who wants to reach out to me to help facilitate communication with ASCAP regarding any issues that you would like to bring to their attention.
And I see that some people just joined us. This is being recorded, and we will share the recording and the emails with you, so people can follow up with you in case they miss something.
Fantastic. Thank you.
I had a question. Avra, did you say you have a goal for when you want a number certified? Is that what is that date again, or what's your time?
Well, we hope to exceed our numbers, but I think we talked about this programming, I believe, is for 3 years. We're in year 2 of it now. So prior to the conclusion of the program, we do have some numbers that we are looking to hit. I think we're We're more than halfway there with the pharmacists obtaining the badge for age friendly. But I would say within the 3 years, we hope to obtain all those goals mentioned.
So just a question for Avra. When will the CE expire? So for pharmacists, this is free CE. So this is a great opportunity to help meet your requirements for your licensure. And it's also, correct me if I'm wrong, this is BCGP credit too for board certification.
So great question. The BCGP credit expires after 1 year. So we're approaching the expiration date for the BCGP for the badge education. We will be coming out with additional education in the future that will be BCGP, but for the one within the badge system or the program, I believe the date is actually October 1st. We are working on communication to share with members out there, but if there's any pharmacists that are not an ASCP member, you may miss the communication, but sign on now and start those modules so that you can get the board certification for geriatric pharmacy credits. It will roll into regular continuing pharmacy educations following that October 1st. And that I believe is for additional 3 years, but we'll continue to update programming, but that CE will continue to be of value as well.
So for those non-pharmacists on the call, so what Ara was just mentioning is that this will be regular pharmacy continuing education, but for those who are board certified geriatric pharmacists, they can also obtain that credit as well and apply that towards their board certification requirements, which are 100 hours over the course of 7 years. So that's having gone through this program, I have to say it's an excellent program. And Deborah did a fantastic job of highlighting very practical resources that folks could put into practice on day one. So thank you, Deborah, for sharing all that information with us. I think it's very useful, and also the stories and thank you for sharing your stories with us too. That really helps drive home the point of how important medications are in the care of older adults.
And other disciplines can take advantage of this education. I see that there was a message inquiring about nurses as well. And we do have nurses that have taken advantage, and they had to contact their board or submit that separately, as it's not already accredited for nursing hours, but it is very relevant and can be accepted by the nursing board.
Absolutely. Yes. Okay.
As well as
Deborah,
social work and others.
And Deborah, I'd like to thank you. Big push right now to get people to become aging friendly nursing homes. And thank you for sharing that information. I just sent you an email. You can tell us the secrets on how to gather that data and demonstrate that we're doing and presenting that to CMS when they ask for it. So thank you.
Thank you so much for the opportunity to share my experiences. My homes are very excited to be part of this. And it's really, especially with the CMS looking at patient-centered, no more standing orders, make it, more patient-specific. And this framework is just all in line with the CMS. So it's for our quality measures, and all of our homes should be doing it. And our geriatric patients are the most at risk.
And I'd also, after 26 years of doing this, I have to say that pharmacists, the consultant pharmacists that work at nursing homes are very aware, and they practice age-friendly initiatives. And perhaps this is an opportunity for all of us I heard this yesterday for the first time, a dandelion, that we take these principles and you blow them and they get seeded throughout our ecosystems and the people that we interact with. And then it can be in nursing homes as well as offices and the community and hospital, just to really populate that. Do we need this medicine? Are there other alternatives? And to have discussions about what matters and preventing delirium. So.
Great points. Great points, Dr. Raymond. Even that New York Times article talked about deprescribing. So the word is getting out. Patients are learning the terminology, and they're going to be expecting that from their healthcare team. They're going to be expecting that we assess what matters most to them, and that the medications are the most appropriate. You know, I always say I've been in this field of geriatrics for 40 years, and the older adults that I saw back then are quite different than the older adults now. We have more tech savvy older adults. They're more demanding, I would say, asking questions and inquiring, and you know, searching Dr. Google, and not always getting the right advice. So our role is so much more important now, countering misinformation and trying to ensure adherence to good common sense and rational pharmacotherapy. So I think this whole program is a step in the absolute right direction. There was a question, and I guess Kathy, I'll ask you: will the slides be available after the session?
Deborah, if you're, do you mind us sharing the slides, or would you rather
Of
share the
course.
recording only? Okay, yes, and then the links, I'll put it in a PDF so that the people can click on the links
Okay.
directly.
Yeah, and just to reiterate what Deborah said, she welcomes anyone to reach out to her to get the whole toolkit that she put
Yeah,
together, which was
I'll email the whole toolkit so you don't have to go on all the references and it's so helpful to print it out for your buildings. So it's just to give them some reference material and make, it's a kind of a thick binder when you print it out, but you can kind of organize the most important sections. But I really love that section about for the CNAs. They to be part of the team. And the CNAs remember to a patient because I asked my mom, it's like, oh, did the nurse give this to you? And she thinks a nurse is, a nurse can be the housekeeper, the nurse can be the CNA, the nurse can be the RN, the LPN. To a
Mhm.
patient, all the caregivers are nurses. So that's what we have to think about. We need to ask our CNAs, we need to ask other caregivers of our patients about our patients. They
Yeah.
know more. They know when that patient wants to go to bed, wakes up, and what makes them happy, and what ticks,
Mhm.
what makes them happy.
Um, I know for those of you who are working in a nursing home or even assisted living setting, this wouldn't be as applicable, but um, in the follow-up email with the recording, I will send information. One of the things we're doing through another grant is sharing the information of assistance programs that are available to New Jersey's older adults. And we have found that doctors are not aware of these. So there are two prescription drug programs. I thought of this, Donna, when you said, are patients adhering? Because
Mm-hmm.
when they're living on their own in the community, the cost of their prescriptions can prevent them from being
Mm-hmm.
adherent. And I will send you, ask people if they want a packet. The eligibility cutoff for these programs is as high as $65,000 a year. So it's not Medicaid or only low income patients. It goes well into, middle class, your average older New Jerseyan. And
Mhm.
access to medicine is something that we all need to be aware of as prescriptions are made and the care plan is made.
Yeah. No, that's a great point. That's a great point, Kathy. So I think the two programs you're talking about, the PAD program and the Senior Goal program,
Mhm.
so those are state funded programs. There's also other programs that may be run through health facilities. For example, Dispensary of Hope is one that I know is throughout the Hackensack Meridian Health System, in which indigent patients who can't afford to get their medications, can get their medications for free. It's that is such a godsend to be able to help with adherence, prevent readmissions. I know how many patients I've seen in the past that come in because they ran out of insulin or they ran out of their high blood pressure medications and now they're in a hypertensive urgency or emergency. So having access to medications, making them affordable. I mean, it's no secret that New Jersey is a high cost state to live in. And so
Mhm.
anything that we can do to help ease that burden of medications so that patients don't have to choose between paying an electric bill or having food on their table and taking their medications is so essential for adherence. Okay. So just a reminder too, there is a short survey that is in the chat. If you can please fill that out so that we can get a sense of, who's on this call today. And then maybe, we could use that for future programming. And then also too, I want to thank Dr. Linda Hasler, who put in the reference to deprescribing. So this is information from the Deprescribing Network. If you go on that website, it has algorithms on how to deprescribe, giving recommendations on how to taper medications, and the criteria that should be used when trying to reduce medications, whether they be statins or the different benzodiazepines, and they give you some great recommendations on that website. That's an internationally known group. Um, Okay. Okay. So thank you, Dr. Raymond. Thank you, Dr. Raymond, for
Thank you.
your insight today and for collaborating on this project. We really appreciate your input. Thank you. Okay.
Great.
Okay. Now, is there
Thank you
any
all
other
for any other questions? Yeah.
any other questions before we wrap it up? Again, I want to thank Dr. Kathy Rowe from New Jersey Advocates for Aging Well, and Dr. Chad Words and Dr. Ava Thomas for putting together this program, and most importantly, also Deborah Scher for actually delivering this important content and bringing this to us and sharing all these valuable resources that help us hit the ground running to expand our care for the older adult in New Jersey. Thank you so much, everyone. Thank you for joining us.
Thank you, everyone.